Hello. Today we are going to be talking about Blatchford Solutions and the life-changing coaching that we do that is for dentists by dentists. And I get to talk with our terrific team here. I have our consultants. We have Nancy Granahan, of course, me, and Kay Puccetti and Carrie Warren. And collectively, we have been doing this for, I would say, about 60 years at this point, if we add all of our numbers together up. And so many years. And so we've been able to work with over 3,500 offices across the US and Canada. And it's something that we are so passionate about to help these doctors really see a pathway to excellent private practice and enjoy profitability. Obviously, that's number one. That's what we're known for.
Right.
And life-work balance is so huge. And we're so passionate about this that you all have devoted, and me have devoted our lives to this. And so what are some things that you see when a doctor comes to us? What are they looking for?
Well, one of the number one things that I hear is time. I don't have time with my family. I'm missing my kids' events. I'm missing them growing up.
Right.
I've taken, 2 weeks off or 1 week off a year.
Right.
It's crazy some of the numbers we hear of how many days a year these doctors are working.
Absolutely.
Yeah. And I think it's sad that they're not able to see their children growing up and being at those events, and pretty soon your kids are gone.
It's a very finite amount of time that you have there. So being able to have that ability to be at these events, and I think that the reason why we talk about profitability first, because some doctors come to us and that is obviously such a hot button for them. Maybe they're having challenging times trying to make payroll, honestly.
Right. Absolutely.
And so they really can't even hear about the life-work balance because they think, taking more time off, are you kidding me? So we need to take care of being profitable according to that particular doctor's definition of being profitable.
Right.
And we do enjoy seeing doctors who have questioned, is this really possible? Is it sustainable? And yes, it is. We've got many offices that consistently do this and grow every year. And I was just talking with a doctor recently, and he's a wonderful doctor, does beautiful dentistry, big name, and his numbers, he has increased his numbers over $130,000 a month for the last 6 months that he's been in the program.
Incredible.
And it's not like he added a bunch of procedures or anything else. It was really just restructuring how they were doing things in the practice and also how they were communicating and talking with patients.
I think, yes, it's huge. And I think systems are another hot, topic, hot button in regards to, so many times, the doctor comes to us as far as there's no systems in place in their office.
It's chaos during the day.
It's chaos. And sometimes you look and you kind of wonder, how they've even been making money, for the years that they've been practicing. But what we do really help you with and help you structure is we do have very proven systems that work.
Absolutely.
That work very well. And also having systems that are going to help you achieve your goals. This is about what your goals are for your practice in your life.
Perfect.
And with all of that put in place as well, it also sets you, the doctor, up as to be a better leader because expectations are met and the systems are in place, and again, everybody knows their role in the practice as a team member.
I think that that's a great thing to point out, because in dental school we have one business class, and it's such the tip of the iceberg, but yet we go into private practice and the training wheels are off starting on day one.
Fly, little bird.
Right.
Absolutely.
Yeah, so I think it's great for these doctors that are asking for the leadership skills, the business skills, and then how do I incentivize my team?
Absolutely.
And what we like to do is we want to encourage your team to think like business owners. So I feel like we have an amazing incentive program for our team members. So I can share in the profitability
Sure.
of the business.
Right. Right.
Right, and I think that when the team members are thinking like business owners, it really takes a lot of pressure off the doctor.
Absolutely.
Right.
You know, the team members are very much incentivized by these bonuses, and sometimes the bonuses can even be well over their regular
Oh, yeah.
paycheck.
Absolutely.
Oh, yeah.
And
So
that's
it's-
why I think we call it life-changing,
Absolutely.
because it's not just the doctor, it's
Oh,
life-changing
perfectly
for.
said.
Yeah.
Right.
It's life-changing for team members as well.
Right.
And we've had those calls from team members saying, I paid off my school loans, or I bought
A new
a new
car.
car,
Or a new
or
house.
I was able to buy my first home. And
Incredible.
it's such a rewarding conversation,
It is.
you know, when a team member is sharing how they have benefited from our program.
Absolutely, and it should be pointed out, though, that it's not at the doctor's expense.
No.
Certainly, that we don't go ahead and say, well, you know, here you are at this level, we need to just go ahead and shovel this much towards the bonus, and then the doctor thinks,
This isn't working for me.
no, absolutely
Right.
not. We want to make sure that we're at a particular level that really makes sense and feels comfortable for the doctor before we even approach a bonus.
There has to
To
be a
the team.
profit margin,
Yeah.
Absolutely.
that
the-
anything above.
Yeah, and the commitment from the team members at that point in time, once we sit down with the doctor and create a, a strategy to move forward,
Right.
it does allow those team members to buy in to what the doctor is trying to accomplish with the work-life balance, with the bonus structure.
Right.
And we have several past team members who have needed to move for spouses, job transfers, or anything
Relocations,
else, and we constantly have phone calls from these past team members asking, do you have a Blatchford office in such and such
amazing.
an area? So team members truly do value what the program brings, and they benefit almost as much as the doctor does.
You know, one thing that we sometimes hear from doctors who are interested in our program is, well, gosh, you know, that all sounds good, but I don't feel like I have the right team now. And I feel like I need to wait until I just have just the right perfect team. Certainly, I have no idea what that's going to be.
Right.
But I feel like I need to wait until I have just the right team. You all go into the offices and do consults, and so you're very closely connected with the team. What would you say to a doctor that says, gosh, I don't think I can do your program right now because I need to wait till I have the perfect team?
You're assuming that you don't have the correct team. Introduce it to those team members and see how they react to it. You may
Right.
not. You
Yeah,
may
you
not.
may
But
not.
we have had several doctors, and I know we've all been in that same position where we've said, yeah, I'm not too sure about this one. And they've turned out to be rock stars. And they are the biggest push for the program in the doctor's practice and the biggest support.
Right.
Because it might not be that you don't have the right team, it might be maybe you don't have the right tools
Right.
at this time.
Exactly, and I
Right.
So-
think that one of the biggest tools that we really share or help the doctor share with the team is the doctor's vision.
Perfect.
For where this is going. And so that the team can really understand with that, okay, so I know the vision, so I can make decisions on my own without having to interrupt my doctor, especially during a focus day, during a day that the doctor's doing dentistry, and say, hey,
Got a
you know,
minute?
yeah, got a minute. I don't know if these envelopes this size or envelopes this size. Or what do you think? So it just having that clear vision eliminates. And I'm being kind of funny with that question,
Sure.
but honestly, you know, it
Still
eliminates,
happens.
right? It
Still
just
happens.
eliminates,
Right, absolutely.
eliminates that and really creates days that are pleasant and fun.
Right.
It brings
When-
the
Right.
fun back to dentistry.
Absolutely. And when I think expectations are clear and set for team members and they embrace it, like you say, you know, I would hope that you do, you know, you have team members that will embrace it, and that those that don't, then you know after a while, that these are not going to be team members that perhaps aren't going to, be
Continue
the
on.
right ones. So then we make a change, and it's all for the best.
And one of the things that Kay had started out with earlier regarding the life-work balance, and one of the reasons that we hear doctors who are interested in our program is because they are just absolutely exhausted. They have
Yes.
so many patients on their schedule throughout the course of the day. They are dragging when they do get home to where they can't even though they're home, they're not able to enjoy their family
No.
when they are home because they're so exhausted from the day. And as Nancy was saying, the systems that we have also restructures how your practice runs. And with a nicer flow, calmer flow, dialed into productivity and how you want your practice to look like.
You're right, and delegating certain tasks to your team so that you don't have your plate constantly overflowing.
Right.
Absolutely. One of the things that we do here as a concern is the cost of the program. What would you say to doctors about how we are able to give tools to be able to not only pay for that, but pay for that many, 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 many times over?
I just recently had a conversation with a doctor who said he has increased his productivity 20% every year.
Incredible. I love it.
So when you're looking at those numbers, 20%, I've increased 20% every year since joining Blatchford, you definitely recoup your investment really quick.
Absolutely.
Right.
And it's also related to your overhead, to know your overhead number, right? So that you can net more.
Yeah, understanding your numbers, and that's something that we work with our
Yes.
offices and
All
our
the time.
doctors on knowing your numbers.
Yeah. And I think we all agree that we constantly hear from our doctors, whether they're just joining the program or only a few months in. I just received an email from a doctor last week who's only into month 3 after attending the Dynamo.
Yes.
And
Yes.
just the little bit that he's implemented since the Dynamo, he has already paid off our program.
Incredible.
And
Yeah.
started putting more money into his
Oh,
college
that story
kids, his
is
kids' college
over and
funds.
over again.
Over and over. It
exactly.
happens all the time. Absolutely.
It's definitely an investment worthwhile, and we will show you and help you with the tools to recoup that investment
Absolutely.
and more.
Right.
And
Yeah.
more and more.
Yes.
Yes, absolutely. Well, thank you for joining me.
Absolutely.
Absolutely.
I think this was a
Yeah.
wonderful discussion about our program, and I just feel blessed to be joined by all of you to really change lives and make such a difference in the lives of our doctors and team members.
Love seeing it
Thank
happen
you.
over and over in our
We feel well
offices.
rewarded as well. Yep.
Yes.
Thank you.
Thank you so much.